yeah, please feel free. We would like this to be interactive, so I've planned it accordingly. My background, I'll go through a little bit. The goal here, and expecting a few more folks to trickle in here over the next couple minutes. We're going to talk a little bit about practical HR considerations for return to work, specifically in context of COVID-19, though some of the conversation probably will extend to an environment that you're familiar with even beforehand. This is a physician's perspective, of course, and as you can tell from the screen here, organizations such as yourselves, everybody is at this point engaging and coming up with processes to try and figure out how to manage the daily shifting expectations around COVID. So for an example, which I have on the screen here, one company, we started our wellness checks at work today, and in that screen there was an answer of a positive cough. This particular person has allergies, has been on medication, is a smoker, and has been asked by human resources, your counterparts, not to return to work until I am cleared by a doctor. Well, let me tell you what that means from our side of the table when asymptomatic carriers are fueling the COVID-19 pandemic, according to Discover and other organizations as well, but Discover being a lay magazine, you might imagine that this is the kind of news that's being spread. Doctors are reading this as well. And so how do you balance being asked to clear somebody by a human resource department with this idea that asymptomatic carriers can actually fuel the pandemic itself? It becomes, as you might imagine, a very tricky situation sometimes. And I'll be honest, I'm sure you're all dealing with it right now. And so I'm hoping to give you a roadmap. I will give you a punchline here, which is that it's complicated and there are no absolutes. What this talk is about is we're going to go through just the ideology that I have, which is that the return to work decision is something that can and should be shared between an HR environment and a clinical environment. I've used HRMD here, but it's any sort of corporate HR environment and any sort of clinical MD, PA, NP, that there's an opportunity for a shared decision there. I want to talk through a little bit about creating a risk corridor for your organization. We're going to review a little bit of a classification system that we've come up with to try and help the decision-making process. And then we have essentially a template that will allow organizations to develop a return to work policy. I've put semi-formal policy here because it's changing every day. You guys know this. Every minute seems to be a new way that coronavirus, novel coronavirus can be spread. Today I was reading about it getting passed along through the soles of shoes, all kinds of stuff. And again, just like you're reading this, so are clinicians, so are families. Very challenging. What this talk is not going to be about is we're not going to go through statistics of COVID-19, social distancing, where to buy toilet paper. You guys can find all of that out, and I'm sure you've read it quite a bit. But we're going to try and stay on task here. I did want to take a minute to just tell you about me. Who's this guy who's talking to you? And again, I've been working with EO for a bit here. As a physician who has started a practice called Percentric down there at the corner. I am, most importantly, a husband and father. I've been a physician for 20 years. I got my MPH and understand health policy. But probably most importantly, I am an entrepreneur and small business owner myself for the last 2 years. My wife and I have, put our heart and soul into Percentric. And we understand, perhaps differently than a lot of medical professionals, what it takes to be a business owner and how to put various considerations into play. Here's where I consider myself well-versed, expert in quotes, but Percentric historically, and by historically I mean pre-COVID, has consulted with employers on healthcare costs. In fact, that was our initial business model 3 or 4 years ago when we started. We also provide healthcare to employees. So we're not only in the executive suite, but we also provide healthcare, usually by on-site clinics combined with doctor by text. We understand and we've prioritized getting to know our clients and the companies we work with. I believe it's a very important part, even before COVID, to understand the company culture. And then as well, we've also built our own software and developed the process a lot around doctor by text. This is not intended as a doctor by text talk. Anything we're going to be talking about can be generalized to your environment. We believe that texting is a tool. We use it like some doctors may use a stethoscope or any other sort of diagnostic option. But we use it to communicate very regularly. What I'm not an expert in, and this is also important, is I'm not an expert in the epidemiology of coronavirus, infectious disease experts, the people who are in the lab. I'm reading about coronavirus like you are. I am translating it perhaps better with understanding of the language of medicine. And I understand infectious disease, of course, but I'm not an expert. And nor am I an expert in the minute-by-minute evolution of the CARES Act or the FFCRA. And this is an important part of why I think a conversation needs to take place between organizations and medical professionals, essentially on a case-by-case basis, so that you can make, as a business owner, the best decision. I'm not an expert in political semantics. This is an apolitical conversation. And nor am I an expert in your company culture. And that is an important variable here, incredibly important variable here, the most important variable here that we want to talk about. I wanted to take a couple minutes here, and so if people are still trickling in, just to point out that we're all human beings. Every text that you're going to see that I put up on the screen is a real text. I haven't edited them at all. And in fact, the vast, vast majority of them, if not all of them, were sent to me before there was any vision of doing a webinar. So I want to just lay the landscape a little bit. So let's take a minute. So some of these are specific to the COVID environment, but I feel like this could be any one of you. There's a lot of feeling of anxiety. Waking up in the middle of the night, people are scared. There are people figuring out what to do with their children who are in college. There are people who are trying to figure out what to do with their 3-month-old twins at home. There are people who are trying to figure out what to do in domestic environments, talking about custody of children. There are people trying to figure out what to do when they call a doctor who tells them to come into the office because of the ways some doctors practice. It's a really challenging situation. And I'm imagining that most of the folks on this webinar right now, you're looking at this from an organizational perspective, but you're all also employees, likely. You have to navigate, you're in a position where you're trying to navigate and put on your organization some guidance, and then you go home and you have some of the same questions. And some of these texts that you're going to see come from executives. We're all employees, we're all human beings in this space. And we can't take that out of this conversation. And that's why at the end, there's not going to be an absolute, but there's going to be an opportunity, I really hope, for you to think about how you can do things better, differently, maybe just the same. So this is the core slide. And because this slide explains a little bit about Percentric even before COVID and one of our primary ideologies. What you're looking at right now is the way companies and the healthcare system currently interact, which is companies are tasked and perhaps burdened with providing employees healthcare and healthcare benefits. But there is essentially a solid line, a hard stop in companies being able to understand anything about their employees' healthcare, and providers, knowing nothing about where the employee comes from, are operating in a completely different silo. And when you look at this very broadly, the incentives and the draws, let's just assume by a bunch of good people, are pulling in very opposite directions. And as an example, I might show you, this is the feedback that I got when I was training doctors. And I used to walk around the wards of the hospital and try and incorporate sort of insurance and cost considerations. And this is the feedback that was anonymously put on one of the evaluations for me one month. A negative saying, I don't think I should be responsible for knowing what insurance the patient has and changing my plan based on that. And this comes from a physician in training who probably should be thinking about all kinds of reasons why he or she should be changing a plan. I think about it still all the time, but it also represents the silo. And so when providers aren't thinking of those things, then they are not vested in the economics of the choice. And disproportionately, that affects you as a company. And so what our proposal has been for a couple years now, and specifically regarding COVID-19, would be to create a model where there can be shared decision-making, and the employees largely will benefit from this. The providers will benefit from this. We'll be able to make better choices. And the companies will benefit from this because their employees will be supported. And you can do this while maintaining confidentiality, while maintaining privacy. And some of that has laxed up a little bit in the COVID era, I guess this month long so far, a little more. But if you want to see in practice how that works, this is a conversation that I was having with somebody where a decision was made as a provider or an idea. And I was asked, hold on a second, I need to go back, and I have personal concerns as a patient that I'm listening to the whole coronavirus space, but I need to go back to work, right? We're dealing with situations now where companies are thinking about things, employees are thinking about things, honest employees who are trying to figure out what their next week is going to look like, if not their next day. They want to work. And then providers trying to piece together this idea of asymptomatic transmission. How do I be the judge and jury to give information to say when somebody, it's just not a space I'm used to in a long-term sense. I mean, I'm okay saying, don't lift that panel of bricks because your back is hurting for a few days. That's a space I'm comfortable in. But what COVID's doing these days, a little bit more challenging. So what I'm going to propose, again, in context of this shared decision, is that we think about and we talk about what the risk corridor is for your organization. You can look at this a few different ways. As a business owner, you might perceive a situation, the situation of COVID, as when you look at an individual employee. I'm not talking about how you think of COVID in general, and again, response and whether it's a high risk or low risk to the United States of America, but whether it's a high risk or low risk to your organization that's trying to stay afloat, that's trying to be compassionate to your employees while prioritizing the basic fundamentals of running a business, what's going to happen for you tomorrow, your family, as well as the families you support as an organization. And you might have the mind that it's kind of low risk. Maybe it's overblown. Maybe your physician has the mind that it's a high risk situation and they're going to be extremely conservative. And then maybe the patient in the middle has their own perception of what the risk is to themselves or to their family members. So you have employees who are well, but live at home with people who are immunocompromised, for example. So you're trying to balance that risk, and that risk is always shifting, right? So I don't know of a way around this other than trying to incorporate as much routine, systematic policy with some degree of case-by-case consideration. Because everybody has a story, and everybody's story has its own influence on whether they want to expose a parent or a child or themselves to an indeterminate risk that can be passed around asymptomatically. And then as a business owner, on top of the employee's risk consideration and the company risk consideration and the doctor risk consideration, you also have, what do other employees think? If I, as a doctor, think it's unlikely that somebody has COVID, and we'll get a little bit more into what that means, but then they go to work and they cough once or twice, what do the employees who are there with that person think? What would a customer think if they saw an employee of yours coughing? And so ultimately, that is not 100% something that I would argue a physician or a medical professional should be deciding for you. It's a collaboration. So let's just take a moment to go through what I consider, this is a classification that I use with clients right now. Here's an example. The itching and redness has increased since Monday on 2 of the areas that were bitten. So this is somebody who, listen, even as COVID's going on, regular life is happening. People are still getting sick and bitten by bugs. This is a person who thought she was okay, but her company told her she just has a cough, no sore throat or anything, mild, and the company wants me to be cleared before I return. And then this is somebody we're working with. Yeah, I'm just having a fever at the moment with shortness of breath and sore throat and a headache. So if you were to give each of these a decree to go to a medical professional and get a return to work note, what is that person supposed to do? I would propose to you that the most I can do is give you an assessment, a likelihood. There's not going to be an absolute yes, and there's not going to be an absolute no. I'm going to assume, for the sake of this conversation, that the majority of us don't have access to any kind of regular testing. And so even if we did, even if we had regular testing, especially if it was negative, but it would still just create the status from high likely to very unlikely. And then working within that, this would be how I might classify the 3 cases that I just showed you. It is very unlikely that somebody who essentially saw himself getting bitten by a spider and had red lesions on his arm, that he has COVID. Now he might, because asymptomatic people can transmit it. But I would say it's very unlikely. And as a matter of fact, this person may not even come to the attention of the HR team, right? In the traditional world of medicine, what happens with your employees is that they have to make a choice. From their couch, they have to decide, am I sick? Am I sick enough to go see a doctor? Somebody with no medical background has to make a medical decision with almost every healthcare encounter. And it's changed a little bit now because we're, as employers, in a position to implore people a bit more. You have to go see somebody, even for things that you wouldn't normally. But somebody who comes in with bites or who sends a text with bites, very unlikely. Somebody who has a cough, and this is just a keyhole view of a conversation, but somebody who just has a cough might be unlikely, let's say, that this person has COVID, might be very unlikely, but it's also plausible. And so as a physician, I would be comfortable in that space saying, this is where I think this spectrum of symptoms may fall. And then lastly, a fever with shortness of breath. I'm fairly confident that this person had COVID, actually had been turned away the night before from testing. And so I was able to say, okay, I think it is likely, and give guidance accordingly, not only to the patient, but also to the organization by way of creating a likelihood classification. That information then needs to be funneled through your risk corridor. So if I say it's plausible that somebody has coronavirus, or possible, then as an organization, it's important for either you to decide or for us to have ongoing conversations about when that person can return to work. My personal approach, especially in the unlikely to plausible space, depending on how conservative an organization wants to be, is to try and do as much micromanaging as possible to the extent that the organization wants it to be. So you're seeing the first blue box here. This is the kind of response that I give to people. And this can be spoken or text or however, which is explaining, I don't think you have COVID-19, but it's not impossible. Let me check with an organization and we'll touch base again in the morning. Let's monitor. Let's see how things play out. Because maybe somebody who's plausible will then become, you know what, this is actually really unlikely at this point. Because with the shifting criteria and expectations that we're being asked. I also happen to be able to explain to people and reassure people about their anxieties. And I would encourage you guys, this is a bit of an aside, but please continue to be vigilant about mental health concerns and considerations. Work with your employees to provide that kind of support in whatever manner you deem appropriate. Then there's this whole other class, which is even more difficult. What I gave you before, this is people with symptoms presenting. Then there's this class of folks that are exposure. And I'm sure some of you have been sort of challenged and frustrated by this already. Here's a couple of scenarios. My brother, this one took me a little while to sort of flush through. My brother-in-law's coworker tested positive and told my in-law, et cetera, et cetera. And so far, it's just my brother started showing symptoms of coronavirus. They said it's too soon to test him, so we're just waiting to see if it gets worse. Again, as a physician, in context with the organization, we can look at this and say, what was this exposure? Significant, moderate, or minor? And again, it goes through a risk corridor. I will explain that as of today, this is the definition of what the CDC says is a potential exposure. It means being a household contact or having close contact within 6 feet of an individual confirmed or suspected COVID-19. The time frame for having contact with an individual includes the period of time 48 hours before the individual became symptomatic, which in a case-by-case consideration is almost impossible to decipher, right? Very difficult, but especially by having suspected COVID-19 in this definition, having asymptomatic transmission as a widely disseminated route, having a 48-hour period included where before the individual became symptomatic, this is everybody. You could argue that this is everybody. And so as a company, you are trying to come up with a place that says, how am I going to define this? Knowing that there's a chance, unless we shut down completely, there's a chance that somebody with COVID is going to be introduced into our workplace. Because this is the kind of text and this is the kind of questions we get both from employers and employees. Remember, your employees, by and large, they want to work. They almost always want to work anyways, I would think, but especially right now, right? They want to work. And so we far more often are getting questions and feedback and pushback about, does it have to be that long? 14 days from when? And unfortunately, the data out there, let alone the information that even I can find who's constantly looking, it's really somewhat difficult to follow. So I told you guys this would be about 20 or 30 minutes, and we're just about there, so we can ask some questions. But here's an actual semi-formal policy that if you want to take a screenshot and use it as a starting point for your own organization, by all means, or you can reach out. And this is stuff that we've used with our clients. And it would be any employee who has symptoms of being sick, fever, sore throat, cough, to name a few, should stay home from work for 24 to 48 hours. And you can massage this, but generally it's a self-reported thing. And how this plays into people's PTO and sick leave, that's an HR internal organizational decision. But right now, giving employees both that decree and that autonomy, if you're sick, stay home for 24 to 48 hours. Work with a physician. It doesn't have to be obviously us, but any physician. Work with a physician. And by physician, I mean any clinician, any provider, over those 24 to 48 hours to tease out details, monitor symptoms, and gather information. Now, this can be a little tricky, I know. And this is where I think our organization is trying to do something a little different, because communicating with physicians can be challenging now. Certainly in-person visits are down considerably. Traditional telemedicine with videos, while better, still has its challenges. And then you still have that silo approach sometimes, where physicians are trying to make conservative one-time decisions where they see somebody with, say, a cough, and maybe somebody who's self-reported a fever, but they don't have a thermometer at home, making a decision for somebody, okay, you need to be out of work for 7 days or 14 days. That doesn't obviously take into consideration what may be appropriate. Maybe it's just, in one day they're feeling better. Again, to have some sort of continuity there would be nice, but to at least get them to work with somebody to tease out details. You could then also ask them that have their physician provide a likelihood that they have coronavirus. This is not an unreasonable ask of a physician. If your employee, if I had a patient show up, matter of fact, I'd like it personally if they showed up and the scale was likely to unlikely instead of yes or no. So, okay, help me understand what this person the likelihood that they have coronavirus. Then HR within your organization can use the physician's assessment as well as state guidance and as well as your corporate culture considerations. How far apart of your employees standing? Do you have an employee who's already been diagnosed with coronavirus that makes not only it more likely, I as a doctor am saying plausible, but it makes it more likely from your perspective because you've had an employee who's been diagnosed, or you have an environment where people are on edge. And then notifying employees within the context of HR appropriateness and privacy that you may ask them about exposures and symptoms so that you as an organization as well can take that information and help feed it into your risk corridor. So real quickly, just examples of a couple companies that we work with. Bauer Compressors is a local company with 250 employees in the manufacturing industry. They've been deemed essential. They are still largely functioning with only a handful of employees that are calling out. And we are consistently working not only with the employees, but also communicating regularly with HR to try and massage, just like I showed you, massage an awareness and an ability to comfortably have people come back to work while having employees be safe. One example is an employee with a potential exposure. Bauer, in this case, might say, we want you to stay out longer. We understand that 7 days or 14 days is the rule or is guidance we've read about, but our assessment of the scenarios and talking to an employee and talking to the doctor, we're just going to be a bit more cautious and we're going to ask you to stay out a little longer. And this is where HR expertise with the FFCRA that is new with the CARES Act, this is where it really is important to understand how how employees are going to get paid back for time off that's related to coronavirus, all of those things. And then another one of our clients is Taste. They have 500 employees, very different environment in the food service environment. So they're managing sort of workload that is shifting, work need that is shifting, how they deliver and provide food. And so they as well we're working with them to not only to help figure out the remaining employees, how to manage them on a day-by-day work shift basis. But what about the employees that have been furloughed or let go? How can an organization continue to be compassionate and look out for their former employees or future employees again? And so that's where, again, communication between HR, so a vested sort of medical voice, and employees, how you can triangulate all of that. So that's sort of the overall sort of structure here. And I wanted to open it up to questions because I'm obviously preaching that there's a case-by-case component to this. But what questions do you have? And is there anything that I can do to help you sort of manage concerns of your local organization?
Yeah, thanks, Dr. Fine. And I think that, one of the biggest takeaways here is really having that semi-formal HR or policy in place for any employer is key, so that even in an environment where you have to take stuff case by case, you do have somewhat of a roadmap, so the employees know that you're taking a tactful approach to it. So thank you for that sample policy. But we do have a couple questions starting at the top. So for those that are on the call, please use the Q&A portion at the bottom of your screen to go ahead and place those answers. We're going to try to get through and get every question answered if possible. So first one up, I've got an intermittent cough, no fever, no other issues. I cannot afford to not run my business. My wife is concerned, and of course, I do not want to be a spreader. But I do want to know if I'm infected. What is the likelihood I am at risk to others, including my family? I do not know how to trade off those risks.
Yeah, it's a great question. And it is, so obviously from a case by case, so this is not intended to be medical assessment, though it's hard to give advice without asking more questions, right? So do I know if somebody with an intermittent cough has COVID? I don't. And because I don't know where you're writing the question from, if you're from New York City versus Norfolk, Virginia, the risk of you being infected is higher. If your business has somebody who's had COVID and you've been around that person. So this is where it takes a little bit of work to understand the risk corridor that you as a business owner are trying to establish. What does intermittent cough mean? One of the medical points I often ask is, are you coughing more at night or during the day? I'm trying to ask questions that help me think that this is more of a traditional flu, right? Or a traditional basic virus, or allergies, which can make people cough. There are so many different considerations. So it's hard for me to just answer what is the likelihood of an anonymous person to pass it along to other. I will say, what I like to do is think about this personally, is that I also need to work. We all and your employees need to work. And so it's a bit of a conversation, and I would ask anybody here to reach out to me afterwards, and I'm happy to flesh through and ask more questions. I don't want it in any way to seem like a cop-out, but there's part of this that is asking more questions to find out how big of a risk you are, and to try and take this 30,000-foot view where the CDC publishes guidance. I don't know if any of you guys have used their screening tool lately, but it's pretty comical. Like, I appreciate the effort for sure, but it's pretty comical to try and interpret that with an organization trying to decide whether somebody needs to come back to work or whether you have coronavirus. So until and unless, which probably isn't going to happen as far as widespread testing, which has pros and cons itself, the answer for that particular thing is I would need more information.
All right. Next up, we have what role will antibody testing play in such a decision making? And is it too early to consider that in a return to work policy?
Yeah, that's a good question. So in this particular case, I will try and be absolute, where I will say it probably is too early to consider this for a return to work policy. The testing from a reliability standpoint is still unclear. The response times for getting test results can be unclear. You've seen that people are testing positive 3 weeks after original symptoms. Like, the data on the reliability of these tests is still all over the place. And so in most scenarios that I have mentioned to my clients, it is unless somebody is genuinely sick and going to the hospital, we are trying to manage them at home. And we are trying to either presume them positive or tease through that space without requiring testing as part of a return to work. If you take it one step further, the guidelines for negative testing, and so you understand how a negative test can happen. Some of this stuff, they put a swab in your throat or your mouth. If they don't stick it back far enough, or it's too early in the process of the virus, that may come back negative. So the official statement is that you actually need a couple of different tests in order to be determined negative. And maybe in the interim, you actually catch COVID. So I would say it is too early for antibody testing for various reasons, but again, happy to elaborate more afterwards.
All right. Next up is I only have a handful of employees, and it's tough to control the message to them. I could not imagine if I had 50 to 100 to 500 employees. How do I answer and keep track of all of their questions and concerns to make sure I am covered as a small business owner?
So I'm trying to think about what you're trying to ask here.
If I could chip in, I think that this is something that every business owner has. You kind of get flooded with questions. Everybody's digesting news and everything. So is there a good FAQ, frequently asked questions, that business owners could grab a hold of and get out to their employees? Because, obviously everything is very case by case, like you mentioned, but controlling the message to the staff, I agree, is very important. So is there a good frequently asked questions forum out there, or should each company kind of develop their own based on their own business format?
Yeah, so my experience is that there's not a lot of good resources because of the inability to generalize the risk corridor for any given organization. There's how they're essential they are, what they see as important to them. And so as a small business owner with only a handful of employees, it depends on what kind of questions they have. And are they asking questions about getting paid? Are they asking questions about getting laid off? Are they asking questions about how sick they are? I guess this question sort of represents that overlap between the HR and the medical space. So it's a little bit too broad. I don't know of a FAQ that I have found that would easily answer all of this. But again, if the person, if you'd like to sort of reach out, which by the way, I'm just realizing I accidentally left the sort of placeholder text number up here. So don't text that number. But we do have a text number that we can use. And the email does work, or reaching me through LinkedIn.
All right, next up we have some employees at our law firm that want to come back to work sporadically. Is it safe to let a few people into the office? We have been closed for 3 weeks now.
Yeah. So another one that I'll try and give a short answer for, I would say yes. Takes into a lot of, it takes into the considerations that your colleague across the aisle, across the hall, or like any business that's functioning at all, if you look at any guidance, essentially, even from CDC, if you're considering yourself an essential business, whether the government is saying you're essential or you need to, as a business, get into the office to be to make things work and to tread water to survive, I absolutely think that you can let people into the office. There is a trust part of this that cannot be understated or overstated regarding your employees being honest about their symptoms. It's harder to ask them to be completely honest about exposure. They would be honest, but I don't think they even know. Yes, somebody coughing a lot and all this stuff, but people you walk past, and now with the social distancing very much in play in most places for the last few weeks. But I'm speaking to you right now from my office because otherwise I would have 3 little children on my lap all around right now. And so I do think that there's a way for people to come into the office. There's a way for people to come into the office at the same time and be separate and practice social distancing, to use hand washing, some really good videos out there and information about how to just be smart about your space. And so I would encourage you, yes, to have employees, if you feel like it's important, and you put in place the education and the process for them to be able to come to work.
All right, next question is, what do you do when an employee seems fine, but they are pushing back, maybe angling to stay home and yet be paid?
Yeah, so this is a really good question. And I think it's almost the best example of why it's important for HR and sort of medical folks to collaborate. Like, that's not going to be something that, as a clinician, as a provider, that I will necessarily be able to tease out, nor do I want to put in the effort to try and tease that out, right? I have employees of clients who want to stay home right now just because they're scared. They're healthy, but they're scared. They don't want to be exposed. The news has gotten to them. And whether that's an angling, I think that's really hard to tease through, certainly for a physician. Now, as an HR expert who has experience maybe with a certain employee, you have a little bit more room to move. There's also the FFCRA, that is probably going to be liberal. I might suggest that right now, the way to go is to be a bit more liberal with that in this immediate space. But as I mentioned, I'm not an expert in the time limits at this point that people are allowed to stay out and get, and organizations can get paid back for the time they're outside of FMLA and that sort of thing. I will also say this, my experience personally, and in fact, how I doctor by text and how I doctor in our clinics, and I think doctors in general, most people are trustworthy. Most people are honest. we believe that most people want to go to work right now for whatever reason, whether it's because they want to work or because they got to make money, or they got to like look out for themselves and their family. So I try and give everybody the benefit of the doubt. But it's a good question, you know, so I don't know exactly.
All right, next question is, it sounds like you need providers serving your employees whom they traditionally choose. They need to know something about your business in order to make these informed decisions and recommendations. And and typical providers don't normally care about your business. They just care about their patient and they're on to the next one, I would imagine. How do you find a provider who can play that role? Clearly, you are a unique provider and this is what you do, but are there providers out there that are willing to talk to an HR person? If you are in an area and you know a large number of your people go to a certain provider, is there a way to reach out and have a conversation about this sort of stuff with a doctor or provider, or do they traditionally not care?
So maybe right there at the end, I think we have two separate points. I think traditionally they don't care. And I think that's wrong. And again, I don't want this to turn into about me. So I'll say this. I think that right now is the time. And one of the points I want to emphasize would be, depending on the size of your organization, depending on how you as a company want to address things, reaching out to a provider or a provider group near you and trying to get them to vest. This does not require HIPAA violations or privacy violations in any way. All it requires is a provider to learn who you are a little bit and put time aside for your questions that aren't in the traditional medical space. Yes, there's probably a cost associated with that, which may seem fair, something that you can work in, may not, but trying to look and find a local provider, a regional provider, a national provider who most importantly makes themselves accessible right now to learn your corporate culture. I obviously believe that is part of the solution right now. That will make it easier and help you make decisions rather than getting a note from an unknown provider saying this employee should be out for 2 weeks, who you have decided maybe is angling to be out of work. And now you've got this note that says they have to be out for 2 weeks. You know, you put that on top of some SBA sort of things where you're required to pay all kinds of variables. So this is a time for you to look into and try and find a provider who can help you answer questions that are specific to your organization.
Awesome. We have another great question here is, how about guidance as these stay-at-home orders start to get lifted and employees return en masse? What sort of guidance do you think employers should be aware of or be subject to as people start, quote unquote, returning to normal?
Yeah. So that is a great question. And as far as, looking forward to the next 4, 8, 12 weeks, obviously some opinion here. I think what's going to happen is that there will be this employer-sided sort of requirements, and then there's going to be the employee-centered drive to maintain social distancing themselves. I think there's going to be a little bit of push and pull here. I think create the workplace. I mean, many of you have probably just completely revamped your delivery model of services and widgets and all of these things, to maybe create a bit of a metaphor of, the handshake that might not happen anymore or as often, like bringing that sort of theory into the workplace as far as people embracing distancing. But I believe, and I am looking forward to people coming back together and to trying to achieve that sense of normalcy and trying to minimize the morbidity and mortality that is a result of the collateral results, morbidity, mortality, the mental health issues, the illnesses that get out of control, the routine illnesses because they weren't managed and taken care of. So I think the main guidelines that employers will need to be aware of and guidance that they should offer is to maintain, smart social distancing, even as people come back in, and try and perpetuate awareness overall. I'm looking forward to stay-at-home orders being lifted when it can be done safely and appropriately. In our state, we are still essentially, stay at home, and most of the time, most people have adhered in my experience so far.
All right, next up, and actually this is the last question on the board. If anybody has anything else, go ahead and type it in there now. But if someone has a compromised immune system and comes in contact with someone with COVID, will they show signs or experience symptoms earlier than the average person? And will their symptoms be different?
Yeah, so the general answer to this would be yes. And again, this comes into play if somebody is dealing with a sick child or an immunocompromised person at home that's sort of one step removed from themselves. But the short answer is yes, we are very concerned, and more so about immunocompromised people, even in the regular space with flu and any kind of illness. There's a hypervigilance there. So I can answer this quickly and easily, which is yes, we are more concerned, and they may show symptoms sooner, and they may be more severe. Excuse me.
Uh-oh. Watch him.
Yeah, no, I'm good. That was I think I'm good.
So that's all the questions. So Dr. Fine, thank you so much for taking the time to kind of run down some considerations for us. And I think we, as more information comes available and this we evolve in our understanding of COVID and everything else, I think a lot of this will change over time. But in the meantime, your information is here on the screen. What states are you licensed in? If anybody's looking for a provider that can interact with their employees, kind of like what you described here, what states are you licensed in?
So I'm licensed in quite a few, 15 states, but I will say this, and I'm happy to send the list to anybody. Right now, the telemedicine regulations have been laxed. A lot of regulations have been laxed. So, and then certainly for any basic conversation to just even help somebody figure out a provider to find or any of those things, I would say just reach out and we can flesh it out from there. But, more or less, we're licensed everywhere on the East Coast, California, Washington State, Arizona, Illinois, and then most states on the East Coast as well.
Fantastic. I appreciate it. Well, if anybody has any questions, please reach out. If you would like a recording of this session, you can email our executive director at executivedirector@eoseva.org. I will try to send out an email to everyone who registered for this online, but if you did not register and you want a copy of this, please email Christina Tate at executivedirector@eoseva.org. Bryan, thanks again. I appreciate the time.
Guys, thanks so much, Marion.
All right.